member was a victim of one of those errors will call us and ask us to look at it.
So when you look at these malpractice cases, where does the problem initially start for most of them? At least the cases you take on, where did the problem that led to that malpractice suit initially start? Was it something going wrong in an office and then it just continued to waterfall?
I will tell you that it can start in any sort of contact with a healthcare provider, literally from people being dropped off the ambulance gurney,
wow,
all the way until right before the end of life. I mean, it can arise in any sort of healthcare setting, and if I had to, and I've never looked at it with this in mind, Scott, but if I had to estimate, most of the cases arise in a hospital setting. Some rise in a pure doctor office setting and then may continue on to a hospital. But I think most arise in a hospital setting, which quite frankly just makes sense because by definition, you're not in the hospital unless you are in relatively urgent need of medical attention of some type, right? So there's lots of different people participating in the care as opposed to a doctor's office where you have one or two people who are participating in that patient's care. In the hospital setting, more people, more communication required to get things done right, therefore more chances for there to be miscommunication that can result in problems.
When you are investigating a medical malpractice case and you go to request those medical records for the patient, your client, how hard is it to actually get the correct medical records? Because I could just imagine, and this is just from the outside looking in, I could imagine doctors, if they're known to do something that's unethical, because you're probably dealing with that at times, I could imagine them not giving you the right records.
We don't see that, quite frankly, and I let me push back gently on the idea of doctors doing something unethical. Most of the time, the vast majority of time, that is not an issue in any of the cases we look at. Have I seen it? Yes, I'll share an example with you in just a moment. But for the most part, what we're talking about is not an intentional error or an intentional cover-up. What we're seeing is instead a mistake that isn't identified before there's harm to the patient. Now, medical records, on that precise issue, getting medical records can be a problem because, as you might expect, healthcare providers have to share medical records with various people. There are the patients, there are insurance companies, there are other healthcare providers, there are lawyers. My belief is that lawyers are at the bottom of the list. So many times we have to wait 30 to 45 days to get a patient's medical records. And sometimes those medical records are not complete. I'd like to think that most of the time the records aren't complete because of oversight as opposed to some sort of cover-up. But sometimes they're not complete, which requires follow-up, which requires more time. But let me share with you one example of a circumstance where there was more active conduct. This was done by a dentist. And when we originally looked at the case, we got medical records. When we determined that the case had merit, after consulting with another dentist, we filed a lawsuit and got medical records, and they were different than the medical records we got from that dentist beforehand. By the way, this case involved a case where a man died after a dental procedure.
Wow.
I've had 3 dental death cases,
that's scary.
It's very scary, and it's very unusual. I've only had 3 in 43 years. But anyway, we had 2 different sets of medical records. And at the end of the day, that dentist admitted, under oath that he had altered the medical records with the intent to deceive the judge, the jury, and his own lawyer, knowing that the only person who could contradict what he put in this new set of records was dead, his patient.
Man.
Now, that is rare. It does happen, but I do think that the vast majority of healthcare providers would never, ever do anything like that. I've seen it. To say that it happens in every case or even 1 out of every 10 cases, no, it just doesn't. I may have a disagreement with doctors about whether they did the right thing or not, and that can get a little testy sometimes. I understand that, but I don't think that the vast majority of them would even consider altering a medical record.
Now, when a patient asks for their medical records versus when an attorney asks for medical records in a lawsuit of some kind, are those medical records going to look the same? Because I know what they sometimes give to a patient is a little more watered down, if you would.
Yeah, they give if the patient doesn't know exactly what to ask for, and sometimes even if they do, when you go in and ask for your medical records, you will get what they refer to in the industry as an abstract. In other words, what they view as the highlights, the greatest hits, they say it that way, of medical records. Once again, I don't think that is something nefarious by the provider. I think that they are making a judgment that you really don't want a lot of the other stuff because it either won't mean anything to you or it's not necessary. The fact of the matter is, in many medical malpractice cases, the devil is in the details. You need the blood work. You don't need the doctor's summary of the blood work in his or her note. You need the chart where vital signs are monitored, not the discharge summary that shows what those vital signs generally were at any given point in time.
Yeah.
The devil is in the details. So one problem that patients face by either attempting to get their own medical records or simply relying on the patient portal that is now available from many providers is that many of the details are not there, that a careful lawyer would want to look at in determining whether or not they could assert a valid medical malpractice claim.
And do you ever find that a patient's records that they requested and got contradict what the doctor actually puts together for the lawyer to pick up?
Well, I'll give you an example of that before. In that case, we had ordered the medical records, but I have had cases where the patient got their own records, and sometime between the time the patient got the records and I ordered the records in connection with an investigation, those records got changed.
And that's what you were talking about with the dentist case.
That's exactly right. And in fact, it was true in the very first malpractice case I tried in 1983. It had to do with prescription medication. And in that case, shockingly enough, the prescription records were altered twice.
Wow.
In other words, I had 3 different copies of the same prescription form in my hands at trial.
That's wild.
And we had sued 4 different healthcare providers in that case. Somebody, I would think it would be stupid to change for the same person to change a record twice.
Yeah.
If you're going to change it, you're going to try to change it once, right? To your benefit. That means to me that either 2 different people tried to change that record or that somebody forgot they changed it once and tried to change it again.
Do you ever have cases where you begin the investigation into what you believe may have gone wrong or what the client believes may have gone wrong, and then you uncover 2 or 3 other things that are out of place or that should not have happened, and then all of a sudden you've got this much larger case than you or the client ever imagined?
Yes. Quite frankly, most people who call us don't know what went wrong. They only know the result.
Yeah.
So they, and again, and they shouldn't be expected to know what went wrong, right? I mean, they're not healthcare providers. So yes, it is not uncommon for somebody to call us and say, my father had these issues and 2 days later he was dead, without them understanding how that came to happen. And I will tell you, and once again, I'm trying to be candid and forthright here. Sometimes what happened wasn't anybody's mistake. It was because what was happening wasn't communicated to them, or at least wasn't communicated to them in a way they could understand it. And then, of course, sometimes people are just forget or block it out of their head. So it is a struggle for all professionals to explain what they are doing and the impact it will have on their patient or client.
Yeah.
I mean, you have to really, really work at it to, as I explain it, put the cookies on the low shelf. That is, help a person who is not a lawyer, help a person who is not a doctor or a nurse or a physical therapist understand some aspect of that medicine, nursing, physical therapy, or lawyering. You got to be able to explain it in language that people can understand, and that lack of or poor communication gives rise to a lot of misperceptions about whether an error actually occurred or not.
You know, from the outside looking in, I could imagine that for some clients, after they have a surgical procedure done and the outcome is not what they expected, and they feel worse than when they went into the first place. I could imagine a doctor coming to that patient and saying, well, here is what is wrong with the outcome of this surgery. And then they will go on to talk about how, well, something didn't work properly. It doesn't work in every patient. But then come to find out what really happened was they put the heart in crooked, or, whatever the case is. But what I can't imagine is the doctor coming right out and saying, here's what I did wrong and this is what happened. Instead, they just kind of gloss over it by saying, well, your body didn't accept it this way, and we'll have to redo it. What really does occur in those surgical situations where the outcome is incorrect because the surgeon did something incorrect?
Well, let me say this first. Surgery cases are really, really hard cases to win in general. And that's because there was only one person in that abdomen. Yeah. Only one person in that operative site. And what he or she says they saw and did, particularly if it's documented in an operative report, is very, very hard for an honest doctor, another surgeon, to criticize. Because stuff does happen during surgery. And therefore, I get calls on lots and lots of people who have bad outcomes after surgery. We can accept very, very few of those cases because there is a risk in every surgery that some things are going to go bad. Let me give you a classic example. A woman goes in to have a hysterectomy and ends up with a hole in her bladder. Okay? The parts are right next to one another. So you say, how does a hole end up in a bladder? It's a separate organ. Can't it be protected such that it is not damaged during the operative procedure? And most doctors will say that yes, it can. And there are doctors who go their entire career never puncturing or putting what they call a rent in a bladder doing hysterectomies. But very few doctors will say that every time it happens, it is as a result of a mistake made by the surgeon. Why? Well, for example, if you have what some doctors call a non-virgin abdomen, that is, it's been operated on before. After your abdomen has been opened and operated on before, it changes the structure of the abdomen, and you can develop what's called adhesions, that is, pieces of tissue that make organs stick together one to another that aren't there naturally. Some people get adhesions, other people don't. It depends on your body makeup. If you're removing the uterus of a woman who has had prior surgery and has adhesions, it is very, very possible for her bladder and her uterus to be attached to one another with one of these bands called adhesions. In order to remove the uterus, you've got to go through this adhesion. That increases the risk of putting a hole in the bladder. That's one example of how this can happen. So, once again, we go back to where I started this conversation. The surgeon is the one who's got eyes on the site. They're in there looking at it through a laparoscope or for the open procedure where they're actually got hands in the abdomen. They're the ones who see the location of the anatomy. They're the ones who can see whether or not these adhesions exist. They have to make the decision on how to make the cut to separate the uterus from any other organ or from the wall of the abdomen. And they're often not going to be criticized for how they do that. Where some criticism can happen is not recognizing you put a hole. So I've had cases like, let me give an example. Let's go back to the uterus case. End up after a surgery to remove the uterus, and there's a hole in the intestine. A hole in the intestine is not a good thing.
I wouldn't think so.
Because bad stuff goes through intestines, and it's supposed to be contained within the intestine until it's eliminated from the body. If it goes outside of the intestine, it gets caught in within the abdomen itself in what they call the peritoneal wall, and it creates an infection, and people die from that. So there are circumstances under which it is not a mistake to put a hole in the intestine. Where mistakes can arise is, number one, not recognizing that you've done it, or number two, in the days that follow, not recognizing that there's an infectious process underway that may give rise to the need to do another surgery to figure out whether there is a hole there or to otherwise treat it. So that's where, just sticking with surgery cases only right now, surgery cases are very, very difficult, but sometimes we find medical errors in either failing to recognize that an adjacent organ has been punctured in some way, or number two, failing to recognize the signs and symptoms of that puncture in the days following hospitalization.
Again, Attorney John Day is with us today, and then, I'm sure you have those cases where the wrong kidney was removed, or the wrong organ altogether was removed or cut open. In those types of situations, what do you do? Because I'm guessing that the patient's going to have to look at doing another corrective surgery after that happens. Then they may have to get on a kidney donor list as well after it happens. So You're talking about the potential of lifelong treatment.
Yes, those cases are called wrong site surgery. So when you go into the hospital, you're asked to sign what they call in the industry an informed consent form, where you give the doctor and the hospital permission to do a procedure or two procedures, whatever they are. And you certify that you've been warned of the risks of that procedure. If you give permission, as a recent case I looked at, to have your gallbladder removed and you come out without a kidney, they took the kidney instead of the gallbladder, That is what they call a wrong site surgery case.
That's really wrong.
Under federal law, or federal regulations, that is referred to as a never event. In other words, it should never, ever, ever happen that you operate on the wrong site. Sometimes there is a fight over who caused that error. Is it the surgeon? Is it the people who prepped the patient for surgery? And I've been involved in one that comes to the top of my head. Operated on the wrong knee. So the patient went in to have surgery on the right knee. The doctor said, the doctor operated on the left knee. And you're thinking, how can that happen? I mean, how can you not know what knee you're supposed to be operating on?
Yeah.
And as you dig into it, just like most things in life, you learn that it's more complicated than it appears. These doctors who are going to be doing these knee procedures have multiple procedures on the same day. Sometimes they haven't seen that patient in days or weeks. These days, with an increase in the number of NPs, they have even less contact with people. And so they depend on other people in some institutions to mark the right knee. Now you see increasing number of times they ask the patient to do it for you, so that to reduce the chance of a mistake. But in this case, I'm talking about the wrong knee was prepped by the pre-surgery staff. And so the doctor's defense in that case was, I have a right as a surgeon to count on the workers at the hospital to prepare the right knee for surgery, the appropriate knee, I won't use right, the appropriate knee for surgery, and I could count on them, and then they fight it out. At the end of the day, it doesn't make any difference. It should never, ever, ever happen.
Yeah.
Ever happen.
During that pre-surgery situation where they're coming in to prep you to get you ready for surgery, they ask you a bunch of questions and so forth. But sometimes during those situations, they may give you Xanax or Valium or something along those lines to calm down so you can be in a better state when they do take you into the surgery room. So you may not be thinking in the right state of mind once you're in that prep room and they ask you a series of questions. If you give the wrong answer, how accountable are you for that answer that you give if it turns into a lawsuit down the road?
Well, all the policies and procedures that I've ever seen from hospitals or surgery centers require that sort of information to be exchanged before mind-altering drugs are given.
But I don't know that really happens every time.
I don't know that it happens either. I'm just telling you that it's not supposed to happen any other way. That they're supposed to get that sort of what we call informed consent before mind-altering drugs are given, so that you can truly give accurate information and truly consent to the care you're about to be given.
So if you have a husband, a mother, a father in that room with you while they're getting you ready and they notice, well, they were asking these questions after they already gave this drug, is that going to have that big of an impact on the case to begin with?
Well, yes, if you can prove it.
Yeah.
I will say this. If you are blessed enough to have a family member or friend who can go with you for things like this, you will likely improve the care that you receive. My joke used to be when I was young and single that I always tried to date at least one nurse just in case something happened to me, so somebody would come to the hospital and watch out for me. For some reason, my wife doesn't agree with that. That's a joke, Scott. That's a joke.
And it's too late now.
Yeah, it's too late now. Yeah, that's right. But I do have a nurse who works with me full time. I think she'd protect me. 32 years. But no, it does make sense to have somebody else there in the room paying attention, not to be a watchdog,
Yeah.
but instead to be a careful observer and say, oh, just a minute, there was somebody else who came in and gave a shot just a minute ago. Is that the same thing type of thing? You know?
We got to take a short break, but when we come back, I'm curious as to how you arrive at a number, to settle for or to ask for in court with some of these malpractice cases, because I'm sure they're literally all over the map as far as those numbers go.
Happy to talk about it. Thank you, Scott.
Attorney John Day with us in studio. We're going to take a short break, and then we'll be right back. Again, stay with us. It is 8:45 right now.
The Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at wgnsradio.com.
Here at Animal City in Murfreesboro, we are your go-to for everything cold-blooded. Whether it's geckos or snakes or tortoises, we've got a great selection. Plus, we've got all the tanks, lighting, and food to set up the perfect habitat. If you're not sure where to start, don't worry. Our team knows reptiles and can help you every step of the way. Come see us at 919 Northwest Broad Street in Murfreesboro. We're open Monday through Saturday, 10 to 6, and Sunday from 1 to 5. Find us anytime on Instagram at Animal City TN.
This is Peter Demas, inviting you to enjoy a meal with our family at Demas's Restaurant. With cold and flu season here, nothing helps my family more than having the Demas's baked chicken and rice soup. It was a soup that was created by my grandmother, and we not only sell it by the cup, but we also sell it by the quart, by the half gallon, and by the gallon. So stop by anytime today and bring soup to your family that may be sick, or a friend that's sick, or just to enjoy it just because it tastes so good. Demas's Restaurant.
Hi, this is Tina Fox at the Rutherford Farmers Co-op. Please come see us for all your cold weather needs. We have a great selection of Carhartt clothing to keep you warm, and as always, our warm muck boots to keep your feet warm. We have anything you would need to keep yourself warm or your animals warm. Please come see us. And if you're trying to feed your feathered friends through the cold months, we also have a wide selection of birdseed. That's the Co-op Farm and Home Center on Middle Tennessee Boulevard, just off of South Church.
In today's changing world, you need a financial planner that you're comfortable with. Rely on the bonds that you've built with trusted friends at Old National Bank on Dr. Martin Luther King Jr. Boulevard here in the borough. And if you just moved here, visit us and enjoy warm, homemade cookies.
Honey, the cookies are ready.
Like Grandma used to make. Old National Bank. We're better together.
2230 Dr. MLK Jr. Boulevard. Old National Bank, member FDIC.
The Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at wgnsradio.com.
8:47 right now is the time. Attorney John Day is with us this morning, and we're talking about medical malpractice cases. And before that last break, I mentioned, how in the world do you figure out what to ask for, and then what do you ultimately get in a settlement or in a courtroom with a jury?
Well, every case is different. But the yardstick for determining how much a jury will award or how much a case will be settled for depends on certain criteria. Number one, first of all, let me say this. You have to prove it's a valid case.
Yeah.
And you have to prove, so to prove it's a valid case, you've got to have the testimony of a doctor who says, or if it's a case involving nursing, it has to be a nurse who's an expert witness. Let's just call it healthcare provider. An expert healthcare provider has to testify under oath that a mistake was made, and that same expert or another one has to convince a jury that the mistake caused an injury or death that would not have otherwise occurred.
Yeah.
So we see all sorts of mistakes in healthcare that don't cause any injury in the long term. It may be, let me give you an example. And I'm not even going to say that this is a mistake. It can be a mistake, but we've all had our blood drawn.
Yeah.
And sometimes it may take 2 or 3 sticks to find a vessel that will deliver the blood they need for the test. Is that phlebotomist making a mistake Not necessarily, because some vessels are hard to find. I've learned my lesson. Drink a bunch of water before you go in to get your blood drawn. It makes the vessels easier to find.
That's a good idea.
Reduce the sticks. But let's assume that the phlebotomist made a mistake. Let's assume. Did that mistake cause an injury? Yes, it resulted in one more stick to get it the next time. Is that a malpractice case? Technically, yes. One more stick. That caused a nanosecond of pain.
Sure.
Is that a malpractice case that any lawyer in his or her right mind would bring? No. Because it's so relatively minor that you can't afford to bring it, and any juror would hear it and laugh you out of the courtroom.
Sure.
Because the injury is minor. I can't tell you, Scott, how many people call me a year and say a mistake was made and I, quotation marks, almost died, or I could have died. But fortunately, some other healthcare provider or a family member caught it before there was a serious injury. We can't do much with those cases either, because while let's assume once again there was a mistake. Let's assume that it caused the initial event. You can't effectively pursue a case unless it resulted in serious injury or death.
Yeah.
So your question was, what's taken into account? What's taken into account from a legal standpoint is what extra medical bills were incurred as a result, or will be incurred in the future as a result if the person lived. What amount of money was lost in wages, or will be lost in wages in the future as a result of the injury? Okay. And what pain and suffering and loss of enjoyment of life was the person who was injured going to, did they experience by reason of this mistake?
Yeah.
That is the yardstick that the jury uses, and that's the yardstick that lawyers use in determining the value of a case. Now you're going to say, well, John, that isn't very helpful. And the answer that it's really not, because it's so much more complicated than that. Lots of other things make a difference. For example, is the case in Nashville or is the case in Lawrenceburg?
Okay.
Same exact case. All the facts are identical. Which case has more value? Nashville. Why? Because there's one hospital, a little hospital in Lawrenceburg. And it may not be the best hospital in the world, but it's the only hospital in Lawrence County. If they're not going to Lawrenceburg Hospital, they're either driving to Columbia, which is 40 miles, or they're going to Florence, Alabama. They can't go to Waynesboro. That hospital's closed. They're not going to go over to Lincoln County in Fayetteville, too far away. When you're fighting a hospital or a doctor in a small town, it's a much harder case. Not impossible, but it affects the value of the case. The doctor in that community, you sue somebody down there, that's the doctor who may be working with the Boy Scouts.
Yeah.
It's the doctor in the JCs. You know, it's an entirely different thing in Nashville or, quite frankly, even Murfreesboro.
Sure.
Bigger communities, less interaction, the social strata tends to separate people more. You can't be separated in Lawrenceburg or Lawrence County. It's too small. So that impacts the value of a case. Whether it is an institution or a individual healthcare provider, I will tell you that suing nurses is hard. People love nurses.
Yeah, I can see that.
People love nurses. Suing hospitals, especially in a larger community, people usually like their local hospital, but they also know they're going to end up there if something happens, and they want to believe in it. They have to.
Yeah.
For their own, right? They have to. So, but it's a whole lot easier than blaming an individual nurse for what happened. So that affects the value of a case. Now, does that mean that I have not won cases against nurses? I have. Does that mean I have not won cases in small towns? Yes, I have. Does it mean that that type of defendant or that what we lawyers call venue, that location of the case makes it more complicated and affects the value? It certainly does. Another issue is the value of pain and suffering, or the value of the loss of a spouse. For instance, if a person dies as a result of a medical error, is now limited in Tennessee to $750,000, plus their medical bills and plus their loss of income. $750,000 in many cases is the most that you can get.
Man.
Because think about, for instance, if a 75-year-old person is killed as a result of a medical error, or in a car wreck even, right? And they're retired and they were not making any money, and their death was, let's assume it was instantaneous or was really quick.
Yeah.
What is the value of that life? The legislature has already determined it can't be more than $750,000. That impacts our ability to bring cases because, well, can I give you an example? Do we have 3 minutes?
Sure.
Okay. I tried a case in Columbia, tough venue, local hospital. They're a strong hospital for that community, but it's their. But I sued some nurses, a doctor, two doctors, and the hospital itself. And we tried that case for 13 days. The woman who died was an 8-stage renal disease. She had a life expectancy of 8 years.
Mm-hmm.
And but she left a young son behind.
Wow.
His mom, right? What is 13 days? I had 8 lawyers on the other side. We won $1.25 million. That was almost 10 times what they offered us before trial. They offered us a little less than $150,000.
That's a big difference.
Now, today that case would only be worth $750,000
because of that legislative
cap.
Okay.
To win that case, I spent $118,000 out of my own pocket and invested over 3,200 hours.
Wow.
At the end of the day, I made $132 an hour. I think somebody else could check my math, but that's what's sticking in mind. I don't need to tell anybody who lives here what you pay for a plumber and electrician on Saturday night.
Yeah, you're right.
And I'm not saying they're overpaid.
Yeah.
I'm just saying that never again can I take a case where there's going to be 8 lawyers on the other side and make $130 an hour because the numbers don't work. Now that number would be cut by over 40% because the cap is $750,000.
Yeah.
So how do we evaluate cases? We value them with those factors that we've talked about so far and a bunch more, but we have to remember that the legislature has decided that in Tennessee, a human life, or what they call non-economic losses of pain and suffering, are limited.
Yeah. Hey, I know we only have a minute or so left, but I'm sure those cases where somebody goes in for an ankle surgery and they accidentally amputate your entire right arm instead of even working on the ankle, but those have got to be worth a whole lot more versus some of these other things. But is there a cap?
No, they're not.
Not.
No, the loss of an arm or the loss of a leg, the pain and suffering aspect of that is only worth $750,000. Losing your eyesight, a brain injury. I mean, truly, if you are in a wheelchair and the only thing you can move is your eyes because of a brain injury,
this is not right.
that is $750,000 is the limit, plus medical expenses and loss of earnings.
Wow. Attorney John Day in studio with us this morning. If anybody has any questions for you or they want to get a hold of you to talk more about legal cases, what's the best way to do that? Go to the website?
Go to the website, johndaylegal.com, and we have our telephone numbers there, and you can also chat with us. And we have 3 people sitting there every single day, and we'll respond as quickly as we possibly can.
Sounds great. Well, thanks for joining us.
Thank you very much, Scott.
Time right now, 9 o'clock.